I think this is often the case from people we talk to as well, LaShawn. You talked about sort of the levels of prevention, right? And I think that's a good way to think about healthcare and public health. So you have like primary prevention, secondary prevention, tertiary prevention. There's some models where you have like primordial prevention and other, but we'll keep it simple. 3 levels. Now, a lot of times the folks who don't pursue a career in public health and have limited knowledge, they often think of public health as healthcare. So services available at the hospitals, beds available, wait times. And while that's a part of the health system, you should be able to consider healthcare as being distinct in some aspects from public health. Public health is primarily concerned with primary prevention. Where there is an overlap with healthcare is through secondary prevention when you're focusing on things like screening.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. My name is Gordon, your host for this episode, and I'm here with LaShawn for a captivating discussion centered around a simple yet difficult question to answer. So LaShawn, one of the things we always hear from our community of people, so whether it's folks aspiring to go into the field of public health or people who are working, have some career experience looking to pivot into public health, is what counts as public health experience? Now, in order to answer the question, what counts as public health experience, we have to first know what public health is. So what is public health?
Public health, as we always say, is super broad, and there are many organizations out there, including Public Health Insight, that has a definition for what it means. So if we go to the WHO, they have a definition of public health is defined as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. So as you could tell, it's a very broad definition. It talks about the art side of public health, the science side of public health, and how those get mingled together when we're talking about preventing diseases, promoting health, and prolonging life, which are key things and key aspects that we do in public health.
Mm-hmm. And the American Public Health Association, their definition is slightly different, and I'm going to quote it here. Public health promotes and protects the health of people and the communities where they live, learn, work, and play. So in that definition, they're touching on those social determinants of health.
Exactly. And I really like that, because when we're talking about where we actually develop and, go about our everyday life as human beings, we talk about where we live, like maybe our physical location, so our built environment, the housing. We're talking about where we learn, so education, schools, these institutions that help support the learning and our development. Where our work, what's our work environment like? Mm-hmm. What is the employment situation like in your community? What are those working conditions like? Where you play, where do you have fun? Like your neighborhoods. You're talking about the cultural aspects of things. So it very much does a good job of touching on those social determinants of health without going too much into it. And I really appreciate that definition, because it really gets to the core of what public health is trying to do and the issues they're trying to address by focusing at these different locations where we see ourselves in.
Absolutely. And the Canadian Public Health Association, their definition is more focused on injury prevention, illness, preventing premature death through programs and services. So you could see that there's a lot of different variety and approaches for these public health definitions, and recognizing that it's weighing more on the Western-centric definition of public health. For those of you who are listening and you're maybe in a different hemisphere, maybe you're in low and middle income countries doing great public health work, we would be excited to learn what public health means to you and what your definition of public health is. So because you're not here with us right now, we're not able to hear you. We're going to tell you our take on public health. So LaShawn, what is your definition of public health? What does it mean to you?
Yeah, this is always a tricky question, and I usually always just list off the different areas of public health. But when I think about public health, I really go back to one of the first definitions that I've learned through the Western MPH program, and I think it's written on the MPH wall somewhere, but it really stuck with me. I'm going to paraphrase it, but it essentially goes like this. Really fulfilling society's needs and interest in ensuring conditions in which people can be healthy. So assuring situations or assuring the conditions where people can be healthy. What does that go back to? The social determinants of health. It goes back to what are society's interests? What are community interests? What do they want? How will we work with them to identify issues that they care about and that affect them? So really kind of considering all those aspects and realizing communities have needs, and we need to help them as public health professionals and assist them and learn from them to help them establish those conditions where they can thrive.
One key thing in your definition that you just put out there from Western MPH is there's an undertone there of free choice and free will, right? So it's not about I'm going to prevent disease and take away all those things that are harmful and don't give you the option of engaging in certain behaviors, whether it's, drinking alcohol does shorten life a bit. You're saying in this definition, it just ensures that if you want to make that choice, the barriers are removed for you to make you have those surrounding conditions that you could be healthy. Is that something that you thought was important for in a definition too?
Yeah, I really enjoy that aspect too. It's really working with the community and seeing what their needs are, right? And meeting them where they're at.
Absolutely. So
what about you? What would your definition be?
Well, Public Health Insight has a definition, and it's very probably shorter than all the ones we've listed. And it's quite simply, public health is a population-based field of science for preventing disease and promoting health. Now, we acknowledge that might look different from community to community. LaShawn mentioned the keyword there, interest. So what is a community interested in? What issues have they identified, and what actions will be taken to resolve those issues? So my definition of public health is public health is everything. So public health is just recognizing that there's an inherent value in health and working on all those structures around it to ensure that there's conditions present for people to thrive. The most heartbreaking thing in public health is when people are deprived by their environment and they want to do better, but their circumstances prevent them from doing so. So that's the very key focus of public health as far as I'm concerned.
Yeah, and one of the things I always think of is there has been this pandemic that started in March 2020 that you don't like talking about. But how has your understanding of public health changed before submitting your application to an MPH program and then after, now that you're kind of practicing in the field?
That's a good question. So I would even say my understanding has probably changed. So since applying for an MPH, since starting to work in public health, and then since the pandemic. So it's evolved, it constantly evolves year to year based on what you're observing in the global environment. So initially, I thought public health was just, there's a certain career that you went into and your job was to make sure people were sort of immunized. You made sure that food was safe to eat. You made sure that there's food inspections and stuff like that. That was my understanding of public health before applying to MPH. Before I go on to the other ones, what about you? What did you think public health was when you were applying to your programs?
When I was applying to my programs, I believe that I thought public health was this generalizable field of prevention. So how do you prevent illnesses? What are those root causes? And it was very much focused at this local level. And I guess to kind of answer my own question in terms of the now, before I let you go, it has definitely changed into considering more of that global aspect of health. So understanding that things that are happening around other parts of the world are definitely affecting us. Case in point, the COVID-19 pandemic, different aspects of climate change. These are all highly complex health issues if you break it down to its core. And they are affecting different communities all around the world in different ways. So understanding that what goes around here in Canada, for example, can affect people, in India or different areas of the world. And what's happening in India can affect different areas of the world as well. So this understanding that we are this globally connected piece.
Right.
And global is local. Local is global.
Okay. So you're sort of saying communities don't exist in a vacuum, right? So if you have a community in the United States, for example, and just piggybacking on the climate change reference, if there are heavily polluting community, they might not see the effects of climate change in their immediate community, but people living in low and middle income countries might bear the brunt of those pollutants. So, like you said, understanding not only maybe there's a high burden of a certain disease in your community, but knowing that your actions of your community, whether intentionally or unintentionally, could affect communities all across the world.
Yeah, and then the point about it disproportionately affects these communities, it's also disproportionate in the types of research that's being done to support the evidence base in these different countries. So sure, we might have a lot of information about climate change in the Western world, US, Canada, but are we putting as much research and that effort into finding out and uncovering details of what's happening in these areas that will face this huge brunt of the outcomes from our pollution?
Fantastic. So another thing, I think it slipped my mind when I was talking about my understanding of public health. I think this is often the case from people we talk to as well, LaShawn. You talked about sort of the levels of prevention, right? And I think that's a good way to think about healthcare and public health. So you have like primary prevention, secondary prevention, tertiary prevention. There's some models where you have like primordial prevention and other, but we'll keep it simple. 3 levels. Now, a lot of times the folks who don't pursue a career in public health and have limited knowledge, they often think of public health as healthcare. So services available at the hospitals, beds available, wait times. And while that's a part of the health system, you should be able to consider healthcare as being distinct in some aspects from public health. Public health is primarily concerned with primary prevention. Where there is an overlap with healthcare is through secondary prevention when you're focusing on things like screening. So, for example, breast cancer, people of a certain age should get screening to see if there's disease before symptoms arise. So that's the intersectionality of public health and healthcare. But once you go out to tertiary prevention for when people already have disease and need treatment, and then before people even have the disease itself or symptoms, which is what public health is mostly focused on, those are 2 key distinctions that I learned through learning through public health programs and then my work right now.
Fantastic.
So, LaShawn, let's talk about the Community Stars Initiative. So, one of the things we realized from our experiences is that everyone has a different perspective or a take on what public health means to them. So, part of the reason we launched this initiative is to endeavor to find out what people's thoughts are across the world on what public health means to them. So if you could just share a little bit more about Community Stars and some of those interesting responses to that question.
Yeah. So Public Health Insight, Community Stars really took form from some of these conversations we've had with our community members. Gordon and I often have these conversations where individuals are asking us, hey, what is public health? What do you think public health is? And so realizing that need to, have an answer to them, I guess, which might not even be possible given the fact that everyone has different definitions. We wanted to just put those definitions out there so we could have multiple perspectives from different countries, different individuals, different areas within public health. Showcase those different perspectives so people can have a more holistic understanding of what public health is. And so what came out of that need was the Public Health Insight Community Stars Initiative, which basically aims to highlight the diversity of individuals working in public health and global health, and just giving them the opportunity on our platform to tell us what they think public health or global health is. Tell us what awesome work they're doing within their communities. Tell us about what message they have in public health and global health. And that message might be an issue that they're personally connected with, that they're passionate about. But we have to remember, oftentimes we have our own biases of, hey, this issue is my favorite thing and I want to tell everyone about it. And we could have gone that way and showed off what we care about as public health professionals, but realizing that there are different perspectives and there's different interests within public health. So we wanted to make sure that those voices got amplified. So to date, I believe now we have over, I want to just ballpark and say around 80 to 100 different community stars. And they all have responded to these different questions that we ask. And, just listing off a couple of them, we have Dr. Cassandra Akinde, who says public health is the multidisciplinary aspect of the health sector that focuses on improving and protecting community health, well-being, and emphasizing disease prevention among large groups of people. So Gordon, how does that compare to some of these other definitions that we've been talking about?
It's interesting because from what I said earlier, right? So recognizing the role of healthcare and public health in an integrated health system. So Cassandra's sort of touching on those points about it being multidisciplinary aspect of the health sector, but the part of the health sector that is primarily focused on protecting community health and disease prevention. So before the disease even occurs and before treatment is even needed. So empowering those communities with the resources and knowledge to take agency over their own health. So I really like that definition.
So yeah, we also have other people who've responded to these questions, like Sarah Levy, who says, to me, public health means identifying accessible ways to addressing people's needs. And I particularly like that definition because it brings and calls out this point about accessible ways. And oftentimes in public health, we might think something might work for a given population or community, but we don't take into consideration the accessibility aspect. So if we have an intervention in the core of downtown, for example, and you want to target individuals from outside of town, are you providing the means for transportation for people to get there? Are you providing that information so they even know about that particular service that they would benefit from? So I like the fact that in this definition, it's calling that out.
No, that one, it's simple yet profound, right? So it's there's not a lot of words there, but it takes a lot to digest. You're beginning to see the scope of public health and that it's integrated in everything that we do and down to the way we live, eat, work, play. And that's kind of coming through in that definition of addressing the people's needs as identified by them.
Exactly. And then we have Zoa Anjum, who's one of the founders of Public Health Connect. Shout out to them, who put out amazing content on social media. They have a great website, so definitely check out Public Health Connect. And Zoa says public health and global health to her is about keeping the health and well-being of every single person at the core of every decision, policy, and intervention. Now, what do you think about that, Gordon?
I couldn't say it much better. It's, recognizing that public health should be intentionally integrated in everything that we do. I think that's kind of the emphasis of that definition.
Exactly. And so you could already see we've listed out a couple of definitions here. They're all different and they're all within the scope of public health, talking about specific things in public health and the remit of public health. So it's very, very, very hard to narrow public health down to one thing. And that's why it's so important to amplify these voices to showcase what public health means to them.
Yeah. And I know there was one too from, I think, Dr. Ketki Joshi. And they were saying public health is all about the 3 Ps: preventing disease, promoting health, and prolonging life. But the reason I bring this up is because it reminds me of another definition that we really liked. And I think it ties more to sort of the intersectionality of public health and health promotion. You remember Robert Lalonde? There was a report in Canada in 1974. And I think just to paraphrase a bit because I can't remember the exact quote, it was about, health promotion or public health is not only about years to life, but also adding life to those years. So prolonging life, but what is the quality of life that they're going to receive from prolonging, and what are those conditions they're going to be living in when their life is prolonged? So we must not forget that as well.
I love that report. That's one of my favorite quotes too. So given what we talked about in terms of these different definitions of public health and global health and these different community stars, you might be wondering, how can you nominate someone to be a community star and to be featured on our platform and to have their voice amplified? Well, if you'd like to do that, you could send us an email at thepublichealthinsight@gmail.com. And basically all you have to say is the person you want to nominate's first name and their email address so we could contact them. The links and everything you need to nominate a star will also be in the description.
We've talked about what public health is. This was inspired from our conversations around what experiences classify as public health. Now, if you have decided to pursue some kind of career in public health or interest in public health, and now you want to know, how do you make a living working as a public health professional? So what careers are out there in the field of public health that maybe people don't know about? Just to create some transparency around that. And the reason I'm asking, LaShawn, is, you go to pharmacy school, you become a pharmacist, you literally Google pharmacist, and it puts a bunch of job postings in your face. If you're a nurse, you look for nursing jobs, and then that happens. But public health doesn't have a specific singular job title that you would pursue after completing your education. So let's talk about some of those careers that exist.
Yeah, there's so many different careers in public health. And that just goes back to this idea that we've been trying to get at of public health is so broad, right? When you consider these different fields like environmental health, indigenous health, health promotion, research, community evaluation, health economics, there's so many different areas within public health. And within each of those areas, there are different professional roles and careers that you could pursue. So, if I take a step back and think about what I thought the career opportunities were before I got my MPH, I'm thinking about things like one of the positions I was in. I was an advanced laboratory technician, a purification technologist at a biopharmaceutical company. And at the time, I very much viewed that from a biochemistry perspective, right? And we worked on, optimizing processes of purification for potential vaccine candidates. And what that basically means in a nutshell is I'm executing lab techniques for purifying different aspects of a vaccine. Okay? And so using different techniques like tangential flow filtration, using active chromatography, it sounds very technical. But that was my world. It was my world in biochemistry, right? But then taking a second to think about what are we doing and what's the bigger picture here? We're talking about creating vaccines for populations that are suffering from vaccine preventable diseases. And that's connection to public health. And a lot of times when we're doing work, we're just kind of fixated to the actual roles and responsibilities of that job. But if you take a second and step back and think about the outputs of what you're doing and how it affects other people, you could more easily find that link. So initially when I was going through that position, I'm like, okay, this is what I'm doing. I didn't really link it to that public health perspective and that population level impact. So that was kind of my reasoning and thoughts of what careers there were before I did my MPH. But then after, you realize, yep, this was kind of just a subsection of it. You could do infectious disease and control. You can do a research assistant position. You could be a community manager. You could be a health promoter. You could be an emergency response specialist. So creating strategies towards preventing the next pandemic from happening or other disasters. So yeah, it's very much expanded my kind of scope and my world around public health.
Awesome. Thanks for giving us that journey even to how you got into public health and your understanding of what a career in public health would look like before you even decided to go into a career in public health. Now, in terms of me, I graduated from Western, focusing, similar to LaShawn, on microbiology and immunology. So I very much had a high level understanding of diseases, non-communicable diseases and communicable diseases. And that was something I was very interested in. But I viewed everything more from a medical perspective. When someone is already sick, what should you do to ensure that they're healthy again? But I never really thought about how do we prevent people from getting sick in the first place? Now, this ties back to my experience after I graduated when I worked as a pharmacy assistant for about 4 years. And I remember for the last 2 years, I just started to feel a little bit unhappy and a little bit frustrated. So folks come in with their prescriptions, diabetes, whatever, chronic diseases as well, recurring bacterial infections, you name it, everything, anxiety, mental health issues. Now, the same people were coming in when I started in my first year. Fourth year, the same people kept coming back. And if you fast forward, even when I completed my program, and maybe just a few months ago, LaShawn shared a very impactful quote that summarized how I felt at the time. And it's from, I think, Dr. Michael Marmot in his book, Health Gap, where he said, "Why treat people and send them back to the conditions that made them sick?" So that's how I started to feel. Like, we dispense medications, people get no better, maybe they get a little bit worse, and I felt very frustrated by that. So I wanted to know what upstream activities I could be involved with to prevent things from happening in the first place and to enhance the quality of life for folks who already have a diagnosable disease or illness. So hence, you fast forward now, I'm working in the chronic disease and injury prevention. So that gives me the ability to have a more in-depth understanding at the population level of why people are getting sick and how to engage in health promotion activities that prevent them from happening in the first place, empowering the people with the knowledge and beliefs that they can make healthier life choices if the conditions are appropriate. So that's kind of my journey into that. You like that, LaShawn?
I really like that. Yeah, I mean, I like how you also tied in that one of my favorite quotes as well. Why treat someone and send them back into the conditions that made them sick, right? They're going to get sick again, right? You're not addressing the root cause. So I really like that. And it very much goes into public health, right? We're trying to find those root causes, those upstream approaches. So what is causing these issues in the first place?
That's right. And reflecting on it too, there were a few examples when people who are on, diabetes medication for years, obviously there's two different types of diabetes. The one where, you're totally insulin dependent, and ones where you can modify with lifestyle changes, right? Without getting too technical. I knew a few patients who were inspired through their family or their family physician or whatever, who made lifestyle changes and were no longer dependent on insulin. So when you see things like that, you're able to realize that not everyone who's being sort of treated for an ailment needs to continue down that pathway. If they have the right motivation, the self-efficacy to make a behavioral change, and the confidence and the conditions, we can alleviate a lot of these health burdens that we see. So that was very inspiring for me. So we went through all this, and I'm going to ask a question that maybe has no answer to it, but I'm going to challenge you to give me something. So we just talked about public health can be related to everything. Is there something that you would consider not to be public health?
No, I mean, it's a tough one, right? Yeah. Because when you kind of break it down to its core, any given issue, any sort of interaction has some sort of health component to it, whether it's mental health, environmental health. And it always brings me back to this idea of this One Health approach, right? So we're talking about the environment, we're talking about animal health, we're talking about human health. So those three things interact with each other all the time. And so it's really hard to kind of delineate what is health and what isn't health at that point, understanding that everything is interacting so prominently. So to me, that's a really hard question, but I think you can, in any given situation, you could kind of parse out those health elements.
Right. Completely agree. So my take on this is maybe the answer is no sometimes, but it's more of like a not yet. So I'll give you two examples. When Facebook was launched how many decades ago, I don't think that anyone considered at that time that there would be severe health implications from that social media platforms and others that would follow, right? So it's more, you don't know about the public health implications yet, okay? Another example that I want to give is I've been binging on CBC Marketplace lately, and even Amazon deliveries have a public health implication. So
The waste.
the waste. So apparently when packages are returned, a lot of them end up not being like repurposed and, sold again. They end up in landfills. And what happens when we don't recycle properly? We contaminate drinking water systems, and it can end up in our body and cause health outcomes. One example as well from our recent podcast that we did on reviewing the movie Dark Waters. So a chemical company creates a chemical that's very convenient for coating nonstick pans. Everyone hates when you're frying an egg and it gets all sticky and it's a nightmare to wash it. That chemical has public health consequences, even though it afforded you conveniences in your home. So everything is tied to public health. And if there's not an immediate connection, you will find out sooner rather than later. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.